doesn't like your finger?
There it goes.
Okay. All right, so in order to meet the CMS requirement, we're going to have two different flows. We're going to separate the PUI and the COVID patients that come in through the front door and through EMS. So how are we going to do that? There's two tents. Tent 1 is the tent next to the ER entrance. Okay, that's tent 1. So what will happen is if you're walking, walking PUI, you're going to come in, you're going to be seen by a screener, and that screener is going to say, oh, you're a possible, person of interest, PUI. You are going to go to tent 1. And in tent 1, there's going to be a physician, a scribe, and either an LVN or an MICN. There's going to be a green recliner in there, and there's going to be a wall. They're going to get registered virtually. These patients are going to be evaluated. You're going to write the orders. They're going to get their tasks done here. X-rays are going to, of course, go to the X-ray room over there in the green hall. We are going to try and refrain from doing IVs, but that doesn't mean it's an absolute. You can still write for IVs. The benefit here, though, is we're going to have a chair outside of the tent. Our goal is so we can start giving actual treatments to patients that are having shortness of breath without waiting for their COVID test. As long as it's outside, we're fine with that. So that's a good thing. Now, this is going to occur between the hours of 11A and 9P. That's our goal. All right, to have a physician and a scribe to manage this. Now, then there's going to be tent 2. So what's tent 2? Tent 2 is where the EMS, possible COVID, are going to be coming in here. So they'll be coming in here, they'll be evaluated. If they're vertical, meaning they're not too sick, they're going to then be offloaded to tent 1. If they're really sick, obviously they're going to go to the green zone, automatically to a bed. There's going to be a nurse staffing here as well. So that's essentially in a nutshell what's going on. So what are the questions? Question number 1, well, what happens if you have a physician here and there's a code in green zone, or a patient here needs to go to green zone? Well, obviously this physician is going to follow this patient to the green zone and take care of it. Now, what happens to these patients while this physician is not here? Well, the physician's going to have to make that determination. If there's a lot of stuff going on in the mix, he's going to call for the backup APP. There's a backup float APP that we've already scheduled, and it'll be a second video on the new schedule. So what will happen is this backup APP will dock halo the dock when they start, so the physician will know who the APP float APP will be, and you can always communicate with that person. The other thing that will happen is we will have a dedicated resident that will also work in this mix from the hours of 2P to 9P. Now, of course, it's going to be a little bit different if it's an EM resident versus non-EM resident, but bottom line, though, is you will have an extra body here as your eyes and ears to manage these flows as well. So that's essentially what's going on in a nutshell with the two tents. Our go live is actually going to be Thursday. Now, please realize that the COVID numbers are going down, so we may only do this for a week. 2 weeks maybe at most is what I'm projecting, but I don't know. The problem, of course, is I want to make sure that there's enough volume here to keep a physician, full. So understand, in some ways, the screening questions, which I always thought were bogus. If you have a headache, then you need to go to the COVID area. Well, we need to learn how to game this system, and I'll tell you how. If you're a physician here, and let's say you're not seeing a whole lot of patients, and they keep funneling patients to you that are kind of bogus, work them up, get it done, get them out of the department. However, if you're getting saturated and you know that person's probably not really a COVID patient, send them over to the other side. So you're going to be able to use your best judgment on this sort of thing, but the bottom line is I want you to try and keep yourself as full as you can. Now, what happens in the event that there's just like no patients and you're not going to just sit here, you're going to go crazy. So what you're going to do then is call your backup APP, and we need to be flexible, and the APP can manage this while you go out and about and see other patients and pick them up. Now, what's very important is whenever you're in the tent, whenever you're in the green zone, you have to wear a yellow gown, and that includes the APP as well. That includes the scribe as well. You have to wear a yellow gown, including goggles and a face mask, okay? Now, the other questions are, so what happens in the morning before 11A, and what happens after 9P? All right, so the morning docs, what you need to understand, this will be 24/7. This is going to be closed from basically 9P to 10A. This is going to be closed. And so what happens during that time frame? So the morning docs, when a PUI respiratory patient comes in via EMS, they're going to be screened in the vestibule. Right now, where we have the 5150s being screened. That will require the morning physician to put on a yellow gown, go in the vestibule, evaluate the patient, write the orders, and then what will happen is the EMS will then be directed to move that patient outside and go and bring them back to the green zone where they'll be waiting their tests and so forth. So it will be a pain for the morning docs because they're going to have to wear a yellow gown whenever they go in that vestibule, and it's going to be the same thing for the night docs. Same idea. When this is closed, they'll still see the potential PUIs, but they're going to be evaluated in that vestibule. And that's basically everything in a nutshell. If you have any questions, obviously let me know. You can also talk to Dane. Dane's also been a part of this whole setup as well. And now there's going to be another video that I'm going to send or create right now with regard to the schedule itself and how it impacts us. Thank you.